Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guest is Greg Miller, Vice President of Industry Strategy for Healthcare and Life Sciences at Talkdesk. Greg is a passionate leader interested in transforming healthcare to deliver better patient and member outcomes. He's been in healthcare for quite a while, starting at Tufts New England Medical Center in my neck of the woods in Boston. And he's been helping healthcare providers, payers, life science companies apply innovative technologies to improve clinical and financial operations with a patient and member-centric approach. Greg, thank you very much for joining us.
Thanks for having me.
So, Greg, I've told a little bit about you and your background, and I'm wondering if you could tell us a little bit about Talkdesk and your role there.
Sure. So Talkdesk, we're a company with close to 2,000 customers in virtually any vertical you could possibly imagine. So historically, we started about 10 years ago in the call center / contact center space, and we've grown quite rapidly. We most recently, though, in the last year or so, decided to make a concerted effort to focus on certain vertical industries. And financial services and healthcare were the first two that we applied significant focus to. And so we've also added in, telco and retail, public government, public sector, and so on. And what we're doing is more than just saying, hey, here's Talkdesk for healthcare. We're actually developing industry-specific products. So for the last 9 months or so, we've been developing something that we recently launched called the Healthcare Experience Cloud, which is purpose-built for healthcare providers, really hospitals and health systems primarily, as well as those post-acute providers as well. And what's really in the Healthcare Experience Cloud is core functionality that we've always provided, but then coupled with healthcare provider-specific functionality. And we've received, fairly substantial reviews so far. So we're pretty excited.
So we often think of a call center as a back office function, and I take it you would say that that's changed either in recent years or over a more extended period. I'm interested in your perspective. But I guess the question is, and you've started to talk about this, what can we see today that we haven't seen before in terms of capabilities of a call center, whether it's provided in-house or outsourced, whether it's live operators or a combination of live operators and technology?
It's a good question. Let me just start by talking about the environmental factors driving the industry right now.
Sure.
It's really around consumer expectations. There's been a lot of articles and people quoted around the overall, Amazon experience, if you will. And I was 2 weeks ago, I was participating in some of the Chime Summer Forum sessions, and you had Russ Branzell, who's the CEO of Chime, talking about how, the next generation of CIOs need to keep in mind the Amazon standard, 2 clicks to anything that they want to be able to find. And so, we as consumers are very, very comfortable, firing up our phone and going to the Amazon app, searching for a product, clicking on one button, and the products magically show up on your doorstep, the next day or a couple of days later. And that's the digital experience that we as consumers expect in every other industry. However, in healthcare, which traditionally lags behind other industries, I think one of the positives coming out of COVID is that during COVID, it did cast a bright, shiny light on how siloed the healthcare system can really be. And it was not uncommon during the height of COVID that people who needed to schedule even a primary care visit, they would sit on hold for 3 or 4 hours. And I think as you think about the healthcare industry up until now, the technology that is predominant, mostly around electronic health records and other clinical systems, have been built around the provider, really with a physician-centric view. And what's been missing is the consumer or the patient view. We've extended patient portals, but we know that those are, limited in use and limited in functionality. And where every other industry puts the customer at the center of their universe, healthcare has always put the provider at the center of the universe. And so
So I hear you not buying the argument that healthcare is different or healthcare is hard.
Well, healthcare is hard and healthcare is different. However, we recently we published a research report a couple months ago now, where we interviewed over 700 patients and over 150 patient experience professionals. And some of the data that came out of it was just screaming loud and clear. One of the statistics that I think was most telling is that 78% of patients surveyed said that they want choice in how they communicate with the healthcare provider, meaning digital communications in addition to voice. So getting back to the contact center or the call center, I tend to think about not the call center or the contact center specifically. I think about managing interactions. And the reason I think about it in those terms is because the call center and the contact center connotes a physical space, and it also connotes a human interaction. Because of, technology such as AI and so on, there are lots of new capabilities, some that we've embedded in the Healthcare Experience Cloud for digital interactions. And one of the other statistics that we learned is that 74% of those patients that want choice in channel say that their channel choice depends upon the context of the interaction. So, for example, when you look at some of the most common reasons why people call into the call center, right? They call a number, they navigate an IVR tree, they may then get set on hold, they may get passed around. Only what they really wanted to do is just schedule an appointment, or they wanted to know if their test results were ready, or I needed a prescription refill. Those types of interactions can be automated by leveraging AI, and can be automated both with a virtual agent voice as well as virtual agent digital in the form of things like two-way texting, chatbots, and so on. So that's why I tend to think about not the contact center so much, think about a command center for managing any interaction, wherever that interaction may be happening, whether it be digital or voice or both.
Well, what I hear you saying is just reiterating what you said earlier, which is making this a customer-centric or patient-centric operation and thinking it from the perspective of that end user. Mm-hmm. And sort of what does that person want to do and how do they want to do it, rather than how do we fit this into a box that we've already built.
Exactly.
So how do you see these systems interacting with existing systems that are already up and running in the healthcare environment?
Yeah, another good question. So obviously there's the electronic health record is predominant system of record, but you also have CRM systems like Salesforce and Microsoft Dynamics that are spinning inside of healthcare provider organizations as well. And so when you think about those systems of record, there's very rich data in there for different purposes. The CRM system, serves a certain purpose. A lot of times it's around marketing, whereas the electronic health record has a lot of detailed clinical information and financial and billing information, obviously, too. And so being able to have deep integration with EHRs is of paramount importance, because then when we have that kind of interaction, one thing that we can do is to be able to synchronize all of the interactions that a person or a patient may have with that healthcare organization. So whether they, for example, they could start on the provider's website and interact through a chatbot, which then could get passed off to, when they need to speak to somebody, maybe they get a virtual agent, voice virtual agent, in conversational format, which then maybe they need to speak with actually a human being. The key is in being able to synchronize all of those different interactions, because I think we've all had experiences where in dealing with healthcare where, you may call a provider because you've got a question about, the piece of paper that you received in the mail that says this is not a bill, but you think it's a bill. So you call and you have questions about the bill. But then you want to be able to schedule an appointment at the same time, and you get passed off to the next person. And then that person asks you for all your information again, right? I think about it as the digital version of the clipboard. And so the key is in being able to synchronize all those interactions, regardless of whatever the channel is that those interactions occurred upon. And then with deep integration into systems like CRMs and EHRs, we can then personalize those interactions, because on the way in, even if they start with like a chatbot, once they authenticate themselves with the integration with the EHR, we know a lot about that person. We can also anticipate then why they might be interacting, whether it be digital or voice. Like, for example, we could see in their electronic health record that a prescription has no refills left. So we can anticipate and say, dear sir, are you calling about your prescription for X? I see you have no refills left. And so being able to take much more of a proactive stance with the person or patient. By the way, I don't always talk about patients because most of the time we're healthcare consumers and then sometimes we're patients. That's how I think about it.
Mm-hmm.
And so, synchronizing all those interactions, personalizing them. And then the last is just making it radically convenient. Anytime, anywhere access, any device, any channel you want. That is what consumers expect. And through the integration with things like the EHRs and CRMs, we can make that a reality.
Do you see the healthcare industry as being resistant to the integrations that are required because of real or supposed issues around privacy and security?
I think privacy and security obviously is super important in healthcare, and so being HIPAA compliant or high trust certified, those are obvious things that are things you don't pass go in healthcare unless you can meet some of those requirements. So that's always something we're thinking about. And whether you're talking about in the United States and you got HIPAA, or you're talking about Europe and you got GDPR.
Sure.
Same type of thing. So we are always thinking about that. I don't see that privacy and security has been a limiting factor in the adoption of more consumer-centric capabilities, like in the call center or the contact center. I think it's a cultural issue. And I've talked with a lot of CIOs about this, and we have a very robust healthcare advisory board with 15 members of their CIOs and health and patient experience professionals from around the country. And the common theme that we have heard from them is not the technology as the barrier, it's the cultural that's the big issue. And so I've had a lot of conversations with them about how to instill a consumer-focused or a customer-focused culture. And we always talk about in healthcare being patient-centric, but unfortunately the technologies have not been built to be patient-centric, and nor have many of the processes in healthcare been built that way. And so it does require a shift in mindset to become more Amazon-like. And I think about organizations like Amazon in particular. They're well known around the globe for having a legendary user experience. And a couple months ago, they launched Amazon Care, and so now they're in the telehealth and primary care business, and that's just where they're starting. So that legendary consumer experience that you expect from buying, electronics and books is now going to be brought to healthcare in primary care and telehealth initially. And so if I was a provider, I'd be paying attention to that. I've read various articles where certain CEOs of certain organizations will say, "Oh, I'm not afraid of Amazon." Well, I think I'd like to go back in time to 1999 or 2000 and ask the CEO of Barnes and Noble if he was afraid of Amazon at the time. We all know Barnes and Noble is now out of business. So I think when you see trends like Amazon Care getting into healthcare, or Walmart, which recently announced their move more heavily into healthcare and the primary care side and telehealth, but also offering really low cost insulin, that's a game changer. And then you look at CVS Health, right? The vertical integration is happening everywhere, and the battlefield is going to be one. I believe the battlefield is going to be one on customer experience.
If you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio. I'm David Harlow, and my guest today is Greg Miller at Talkdesk. Greg, I'd like to probe a little deeper into the AI that's involved in powering your healthcare operation, your healthcare cloud. And I'm wondering what kinds of things are the inputs into this? Are we drawing, you mentioned EHR integrations. Are there other integrations that are necessary in order to make this work, in order to build the intelligence that's going to be specific to a particular application?
Yeah, good question. So in my 35-year plus career in healthcare IT, I've spent probably almost 25 years in and around the data and analytics space. And to really make AI powerful and effective, it needs data. you got to feed it with data so you can train the models and so on. And they get better and better over time. And so there's different forms of AI that we have. So our entire platform is AI infused as we think about it. And it's our goal as a company to be able to automate 80% of all interactions by 2023. Not just healthcare, but in any industry. So that means, just a big investment into research and development around the AI capabilities. And so while there are general AI capabilities that we provide, and we use customer data, we use EHR data to train the models to get better and be more accurate. We also have AI, healthcare specific AI components that are embedded into the healthcare experience cloud, such as medical grade speech to text, being able, when somebody says, I'm calling and I need to refill X, they're talking to a virtual agent and I need to be able to refill X prescription that has some funky name. Our platform needs to be smart enough to be able to interpret that and say, oh, that's this medication. So it's medical grade speech to text and things like medical grade natural language processing. Those are two very specific forms of AI that we built into the healthcare experience cloud as well. And so we're constantly looking for new ways, and we are hungry for data. So the more data we can feed, that we can touch with our platform, the better AI gets.
Sure. So that makes it possible to tailor this better, to speed up the process and the experience, as you described, trying to reach that Amazon grade, that consumer grade experience. I'd like to push a little further into the last year's worth of experience. We're sort of coming out the other side of lockdown, the whole coronavirus pandemic experience. Hopefully we're coming out the other side here. Mm-hmm. And I'm wondering if there are specific learnings from this past year you started to talk about, if you could elaborate on those and sort of what we take away from this period in time.
Yeah, I think I'm always the eternal optimist. And there's always the old adage, is the glass half empty or the glass half full? For me, it's usually overflowing. So I think when I think about the last 14, 15 months or so, I see a lot of positives. One, I mentioned earlier, right, that it did cast a light on the siloed nature of healthcare, and consumer expectations are now really getting vocal about the need to transform healthcare and make it consumer friendly. But I also see, just from a digital transformation perspective, just massive and rapid acceleration of digital capabilities. In the same Chime keynote session where I was listening to Russ Branzell, and when he was interviewing Rick Pollack, who's the CEO of the American Hospital Association, and Rick had made a comment that patient experience is the new measure of quality. And to me, I thought, wow, that's a really great way to say it, because now our expectation, and organizations like CMS, they are heavily rewarding great patient and member experiences. Mm-hmm. And so when you think about some of the natural acceleration of digital technologies like telehealth, right? And Russ was talking about it, where healthcare organizations were on a 10 to 15 year journey for digital transformation that had to be accelerated down to 10 to 15 months. And those are some of the positive things. So we are so electronic, digitally aware in every other part of our lives. Why can't we be in healthcare as well? So I think that's all goodness. I think, related to that, the digital acceleration and the transformation helped to do things like relax some laws around reimbursement and practicing medicine across state lines and making it more ubiquitous. And when I think about that in the bigger picture, where rural healthcare is always a challenge. It's hard to recruit physicians into some of these rural areas. They pay a lot of money to get them there. But now people in rural communities can leverage telehealth and digital technologies to get care into the hands of people that really need it and don't have the same accessibility that we do for those of us that live around major metropolitan areas.
Right. And we certainly hope that some of the special rules, pandemic rules, can be extended, because some of them are snapping back under mm-hmm. Medicare and other payer rules and really need to be expanded out, whether it's payment or licensure mm-hmm. or other sorts of issues. Do you see any particular areas at risk there where things are snapping back and they need to be expanded out on a long-term basis?
I think we'll work through it. It is a new world for a lot of people in that regard. But then I do think about organizations, you mentioned Medicare and, the hospital at home program. The hospital at home concepts has been around for a long time, but they weren't really enabled. And digital transformation can now enable things like hospital at home and moving into lower cost care venues and more personalized care venues for the patient. And those are good things that I don't, of course it is tied to Medicare reimbursements and that type of thing, but I think the cat is out of the bag, so to speak, that these are effective and preferred ways of delivering care, not just, oh, here's another way to deliver care, if that makes sense.
Right. Yeah, I think it does. I guess the question is whether we can continue to move forward and whether there's a risk of being pulled backward by existing inertia of regulation. I guess a related question is around digital therapeutics. Do you see the work that you are doing as leading towards development of additional breakthroughs in that area, whether it's with your company or in the industry generally? I mean, do we see voice technology and the AI tools around it leading to development of more digital therapeutics?
For sure. We interact with all kinds of companies every day that are very innovative and doing really cool things that are complementary to what we do, that really extends and enhances the patient experience, but also feeds us with more data that then makes things like the AI all that much better. So I think we're seeing all kinds of really cool things. I mean, I remember it was probably maybe 3 years ago, where I was with a company called Health Catalyst at the time, and Eric Topol was one of our keynote speakers at our annual conference, and he was talking about and he was showing an ultrasound device that connects to a person's smartphone, and the device itself costs $200, and the image quality is as good or almost as good as being in the, getting an ultrasound in the hospital. And the ultrasound in the hospital costs $1,200, but the device only costs $200. Those are really positive transformational types of things that you're seeing every single day now.
Right. Certainly a lot of progress. So with all that progress as a prelude, I'll lead into my final question, which is, if you were to wake up tomorrow and find yourself 5 years in the future, what's one thing in healthcare that you would hope or expect to find has changed drastically?
I would hope to find a lot more transparency and a dramatic reduction in cost with significantly improved convenience for healthcare consumers and patients.
So I will push you a little bit to say more about transparency. What kind of transparency are we talking about?
Well, you saw, just even this year, right, the new law that came into effect where every provider organization has to publish their prices. I think that's it sounds revolutionary, but you find that in every other business, right? You can find out what the price for X, Y, or Z is. But in healthcare,
right? It's like the old joke of, if healthcare were a restaurant,
right?
You have your dinner and find out what it costs 6 months later.
Yeah, well, it's that too. And you think about the restaurant analogy where you go to a restaurant. Can you imagine getting a bill from the busboy, a separate one from your server, a separate one from the chef? That'd be crazy. You would never tolerate that in a restaurant, but we do that in healthcare today. And people just don't really understand what is in the cost of healthcare and why is it $40,000 for a hip replacement one place and it's $16,000 another place. Those are the types of things that will help to the transparency will help to bring down the overall cost of care and create real competition where provider organizations have to compete on quality, safety, and experience, not just on the prices.
Very good. And we'll leave it there with improvement and experience. Well, thank you very much, Greg.
Well, thanks for having me. This is really fun.
You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com. Let's continue the conversation on building the future of healthcare together at hashtag Harlow on HC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.